Welcome to our presentation on New Jersey physical therapy dry needling requirements. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. A physical therapist in New Jersey may perform dry needling if all the following requirements are met: possesses a doctorate in physical therapy from an accredited college or university, or otherwise been actively licensed as a physical therapist in New Jersey since January 1st, 2003. Has no less than 2 years of active clinical experience in treatment of patients and license in New Jersey, and holds current unrestricted license to practice physical therapy, has a current CPR certificate, and has obtained documentation of successful completion of dry needling continuing education and competency programs approved by the board. The course requirements are as follows: a minimum 40 hours of academic instruction by which attended in person by the physical therapist and completed within 2 years, provides a history and current literature review of dry needling and evidence-based practice, covers pertinent anatomy and physiology, covers the choice and operation of dry needling supplies and equipment, provides knowledge of dry needling technique including indications, contraindications, and precautions, and provides knowledge of risks and complications of dry needling. Continuing on, it covers the safe practice guidelines and generally accepted standards, including clean needle techniques, the OSHA's bloodborne pathogen standards, provides knowledge of post-intervention care, including adverse response or emergencies, documents the successful completion of psychomotor and cognitive performance by means of practical and written assessments or examinations, and provides a minimum of 40 hours of practical hands-on instruction in the application and technique of dry needling under the direct supervision of a licensed PT or physician which shall be completed by the PT in no more than 2 years. The dry needling continuing education and competency program, including the practical hands-on instruction, must be taught by a licensed physical therapist who has a minimum of 5 clinical years experience in the performance of dry needling, or by a physician licensed to practice medicine and surgery in New Jersey. As an ongoing requirement, a physical therapist must complete 10 of the required minimum credits of continuing education and competency in each biennial license renewal period in board-approved programs in dry needling if the physical therapist chooses to continue to utilize such intervention on patients. For patients who receive an order, prescription, or referral for physical therapy from a New Jersey licensed physician, osteopath, or podiatrist, dry needling shall only be performed on the patient after the physical therapist licensed in New Jersey to perform dry needling communicates with the physician who ordered, prescribed, or referred the patient to physical therapy. The communication must address the physical therapy diagnosis of the patient, the specific dry needling technique that the PT intends to utilize in the treatment of the patient, the proposed number, size, and insertion points of the needles, and any elevated risk factors that the patient may have. The PT shall maintain documentation of such communication in the patient's record, and in no event shall a physical therapist perform dry needling on a patient if, in the medical judgment of the physician who ordered, prescribed, or referred the patient to physical therapy, dry needling is contraindicated or clinically inappropriate, and such judgment is clearly communicated to the physical therapist by the physician. A physical therapist shall obtain written informed consent from each patient prior to the provision of dry needling. The patient shall receive a copy of the written informed consent, and the physical therapist shall retain a copy in the patient's record. The informed consent shall include the minimum following: the patient's signature, the risks, benefits, and possible complications of dry needling, the treatment alternatives to dry needling, the PT's level of education regarding the supervised hours of training in dry needling, and the importance of consulting with the patient's physician in regarding the patient's condition, and clearly and conspicuously written statement that the patient is not receiving acupuncture, which shall include the following language. Dry needling as a technique used in the practice of physical therapy to treat myofascial, muscular, and connective tissues or for the management of neuromuscular pain and movement dysfunction. Dry needling techniques should not be confused with an acupuncture treatment performed by a licensed acupuncturist. A PT shall only use filiform needles labeled in accordance with the United States Food and Drug Administration guidelines when performing dry needling. A PT shall perform dry needling in a manner that is consistent with generally accepted standards of practice, including clean needle techniques, safe disposal of sharp objects, and OSHA's bloodborne pathogen standard. A physical therapist shall maintain documentation in the patient's record for each dry needling session. The documentation shall include the treatment performed, the patient's response to the treatment, and any adverse reactions or complications to the treatment. And the performance of dry needling shall not be delegated to a physical therapy assistant or a student physical therapist. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.